The long road out of lockdown will be gradual and cautious, a decision the government said was based upon data rather than pressure to set dates.
We cannot persist indefinitely with restrictions that debilitate our economy, our physical and mental well-being and the life chances of our children. And that is why it is so crucial that this roadmap should be cautious but also irreversible. We're setting out on what I hope and believe is a one-way road to freedom.
The government's now confirmed all schools will reopen for all children on March the 8th. Many have already adapted to continue teaching the children of essential workers throughout the pandemic. Students and staff at this school have regular lateral flow tests on the school's premises. This looks set to continue when the rest of the children return. After the reopening of schools, allowing people to have more social contact will be a priority. For March the 29th, up to 6 people or 2 households can meet outside, including in private gardens. This is when the stay-at-home order is expected to be lifted. The move follows encouraging new data indicating the Pfizer and Oxford vaccines used in the UK can reduce hospital admissions by as much as 94%. The UK is hoping its lead in the vaccination campaign will allow it to recover faster than other countries. Further stages for England, several weeks apart, include the reopening of non-essential shops and the phased return of people to pubs and restaurants hit hard by months of closures. The reopening of hotels and hairdressers will follow, but the prospect of foreign travel or summer holidays seems some way off. The easing of restrictions can only move to the next phase, providing 4 criteria have been met. That previous measures do not in any way affect the vaccine rollout, that there isn't suddenly an increase in infection rates, or the National Health Service isn't adversely affected by any of these previous changes. And lastly, if there is any concern at all about the possible impact of any new variants. More than 17 million people have received at least 1 dose of a COVID-19 vaccine. Infection rates are falling quickly across the country, with an 80% drop in cases in the capital. Cases of the South African variant are also shrinking, but after months of disruptive on-off restrictions, the last thing anyone wants is for a taste of normality to be suddenly taken away.